Avoid dialysis. 5 early signs of kidney damage. You must not ignore. Imagine this. It's the third time tonight you've had to get up to use the bathroom. Is this just an annoying part of getting older? For 1 in 7 Americans, that quiet inconvenience is one of the few warnings your body gives about something far worse: chronic kidney disease, or CKD for short. And 9 out of 10 people with CKD don't even know they have it. Kidneys fail in silence. Over 10 to 20 years, they can lose up to 90% of their function before you feel a thing. And when you finally do, it's dialysis or transplant. Most never get a transplant. And dialysis? It's 4 hours a session, 3 times a week, for life. But here's the thing. You don't have to wait for disaster. Catching the signs early isn't the end of something. It's the beginning of your best chance to protect your kidneys for years to come. CKD often shows no symptoms in the early stages. But early diagnosis is possible, often through abnormal lab tests. We'll get into those tests shortly. But first, let's talk about 5 early signs of kidney disease you can notice at home. Signs you can see, feel, and do something about. Just so you know, everything in this video is carefully researched and put together by real people, double-checked by actual experts, and kept bias-free. 5. Foamy urine. You've just used the bathroom, and as you're about to flush, something catches your eye. The toilet water is unusually foamy, with small bubbles that don't seem to disappear. This persistent foam, looking almost like beaten egg whites or frothy beer, might actually be your kidneys sending you a message. Foamy urine appears as persistent layers of small to medium-sized bubbles. It's easy to dismiss this sign. Who spends time analyzing their urine, right? Many people feel embarrassed to even mention it. But remember, this is how your body communicates with you, and paying attention isn't strange. It's smart. What's normal? A single layer of larger bubbles that quickly dissolve is usually nothing to worry about. This happens due to the force of urine flow or normal substances in your urine. But when bubbles are smaller, more numerous, and stick around like foam on a latte, that's different. The reason for foamy urine in CKD is proteinuria, the presence of proteins in your urine. Proteins like albumin normally stay in your bloodstream and aren't supposed to be in your urine. But when your kidney's tiny filters become damaged, these proteins leak out. This protein leakage can lead to dialysis if left unchecked for years. You can perform a simple home check. Urinate into a clear container and observe. If foam remains after 3 minutes, that's worth mentioning to your doctor. Albuminuria is among the earliest signs of kidney disease and can even appear in stage 1 CKD. However, only about 1/3 of people reporting foamy urine actually have abnormal proteinuria, so don't panic. Just pay attention. 4. Nocturia, or nighttime urination. You're still getting up twice, sometimes 3 times a night. Your morning coffee isn't even the culprit anymore. Something else seems to be happening with your kidneys. Nocturia, the medical term for getting up to urinate at night, occurs with polyuria, the production of excess urine that can happen with CKD. The disruption of salt and water balance in kidney disease can lead to either nighttime only or around-the-clock excessive urination. What's normal? For younger adults, going through the night without bathroom trips is typical. For those over 65, 1 nighttime trip might be normal. But regularly needing to go twice or more deserves attention, especially if it's a new pattern. This disrupted sleep isn't just annoying, it affects your quality of life. A practical tip while you're addressing the underlying cause: place night lights along the hallway to your bathroom to prevent falls during those middle-of-the-night trips. Age-related changes in circadian rhythms, your body's internal clock, can also contribute to nocturia. Other causes include diabetes, prostate enlargement in men, pregnancy, urinary tract infections, and certain medications. But when it comes alongside other kidney symptoms, it's worth a closer look. Research suggests that declining kidney function is associated with nocturia and correlates with increasing frequency of nighttime bathroom visits. Kidney function is measured by how quickly your kidneys filter waste, called the estimated glomerular filtration rate, or EGFR for short. In a 2023 survey study, EGFR was slightly decreased in people with nocturia compared to those without. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. 3. Blood in the urine, or hematuria. You're in the bathroom, and something stops you cold. Your urine is pink-tinged, or perhaps a dark tea color. This moment, as unsettling as it is your body sending up a red flag that deserves immediate attention. Hematuria is the medical term for blood in the urine. This blood may be clearly visible, gross hematuria, or only detectable under a microscope, microscopic hematuria. Early kidney disease can present with either type. What blood in urine actually looks like varies. It might appear bright red, pink, cola-colored, or tea-colored. The color depends on how much blood is present and how long it's been in your urinary tract. Rather than panicking, use that concern as motivation to see your doctor promptly. Many causes of hematuria are treatable, especially when caught early. Unlike gross hematuria, microscopic blood isn't visible as a color change and is typically detected only during testing. Urine dipstick tests and microscopic examination can confirm the presence of blood. A 2018 study revealed that microscopic hematuria in patients with moderate CKD indicated an increased risk of disease progression and death during the first 2 years after testing. The research also showed that the prevalence of hematuria increased as EGFR levels fell, confirming its importance as a warning sign. 2. Decreased urination. You realize you've only used the bathroom twice today, whereas normally you'd go 5 or 6 times. This isn't because you're drinking less. In fact, you've been careful to stay hydrated. Decreased urine production, or oliguria, can be associated with CKD, though CKD itself rarely causes low urine output directly. More commonly, it happens when acute kidney injury, or AKI for short, occurs on top of existing CKD. What's normal? Most adults produce about 1 to 2 liters of urine daily, which translates to urinating about 5 to 6 times per day, depending on fluid intake. A significant decrease from your personal normal pattern is what matters most. This reduction can happen if you have a chronic urinary outflow obstruction that contributes to CKD, and then develop urinary retention with little to no urination. Other causes include severe dehydration, shock, or reduced blood supply to the kidneys. You might notice swelling in your ankles, hands, or around your eyes as your body retains fluid that would normally be eliminated. A simple observation. Pay attention to whether you feel like your bladder is full, but you're having difficulty urinating, or if your urine volume is significantly less than usual despite normal fluid intake. 1. Flank pain. That dull, persistent ache in your side doesn't seem related to yesterday's gardening or that new exercise routine. It's deeper, more internal, and sometimes comes with a wave of nausea. This pain, located between your lower ribs and hip on either side of your spine, could be your kidneys calling for help. Flank pain occurs much more commonly in people with CKD compared to the general population, either due to direct kidney involvement or associated conditions. Unlike typical back pain that might ease with stretching or changing positions, kidney-related pain tends to be persistent, regardless of how you move. How to locate it. Place your hands on your hips and slide them up toward the back until you feel your lower ribs. The area underneath is where kidney pain typically manifests, deeper and higher than standard lower back pain. Chronic flank pain is the most common symptom of polycystic kidney disease, where fluid-filled cysts develop in the kidneys. Other kidney conditions that increase your risk of CKD and may present with chronic flank pain include kidney infections, inflammation, tumors, and abnormalities in the kidney's blood vessels. Beyond the kidney itself, obstruction in the urinary tract, such as from kidney stones or congenital blockages, also predisposes you to develop CKD and experience flank pain. The pain might radiate to your groin or abdomen and vary from mild and dull to severe and sharp. It's important to remember that flank pain doesn't automatically mean kidney disease. Many conditions can cause similar discomfort. However, when combined with other symptoms we've discussed, it becomes a more significant piece of the puzzle. So, how can I know I'm at risk? The risk of developing CKD increases significantly if you have certain conditions. Take this quick self-assessment. Are you taking blood pressure medication? Do you have diabetes or prediabetes? Has anyone in your family had kidney disease? Are you over 60 years old? Have you ever had a kidney stone or urinary tract infection? The more yes answers, the more important regular kidney screening becomes. But why do these factors matter? Hypertension and diabetes are the two most common causes of CKD in U.S. adults. High blood pressure puts stress on the tiny blood vessels in your kidneys, gradually causing them to narrow and harden. Diabetes damages the kidney's filtering units over time, similar to how sugar gradually corrodes pipes. An estimated 1 in 5 people with hypertension and 1 in 3 with diabetes eventually develop kidney disease. Living in regions with high CKD prevalence, environmental exposures, recurrent kidney stones, abnormalities in the urinary tract, HIV, lupus, certain medications, and radiation therapy also increase your risk. When kidneys struggle, complications multiply. Fluid and toxin buildup, high blood pressure, electrolyte imbalances, anemia, heart disease, and weakened bones. These complications explain the symptoms seen in advanced stages: fatigue, poor appetite, metallic taste, nausea, weight loss, swelling, shortness of breath, and confusion. By the time these advanced symptoms appear, dialysis is often inevitable, which is why recognizing early warning signs is so crucial. You might not feel different, but tests can detect these changes before symptoms appear. Which tests can help you detect kidney disease early? Recent research shows that earlier diagnosis significantly delays further decline in kidney function. This was proven by lab values taken 2 years before and after CKD diagnosis. Delays in diagnosis and late-stage identification increase complication risks. If you have risk factors, especially hypertension, diabetes, or heart disease, annual screening is essential. These tests can identify declining function years before dialysis. For type 1 diabetes, screening should start 5 years after diagnosis. For type 2 diabetes, it should begin immediately at diagnosis. Key tests include serum creatinine measurement, which allows calculation of your eGFR, blood urea nitrogen, or BUN for short. Another waste product measurement, though less reliable than creatinine. As kidney function declines, creatinine levels rise, showing your kidneys aren't filtering properly. Urine tests check for protein, particularly albumin, in your urine. Measure the albumin to creatinine ratio to estimate protein loss. Examine urine under a microscope for abnormalities. Evidence of kidney damage includes protein or blood in urine, abnormal microscopic examination, relevant findings on imaging or biopsy, electrolyte abnormalities, or history of kidney transplant. The hallmark of CKD is reduced kidney function for at least 3 months. Doctors categorize this decline into CKD stages 1 through 5 based on your eGFR, a measure of how well your kidneys filter waste. Curious about the science behind it all? We've linked the studies that support everything we've shared. You'll find them down in the description box. The cost reality and saving strategies. The financial burden of kidney disease is staggering. Annual Medicare spending in 2020 for people with CKD aged 66 and older was $75 billion. For end-stage kidney disease or dialysis, it reached $50.8 billion. Dialysis alone accounts for nearly 7% of Medicare's entire budget, despite serving less than 1% of its beneficiaries. Let's break this down to a personal level. A single year of dialysis can cost upward of $90,000. A kidney transplant averages $260,000, plus ongoing medication costs. The average dialysis patient spends $13,900 out of pocket annually, even with insurance coverage, a life-altering financial burden for families. By contrast, early detection and management might cost just a few $1,000s annually. The math is clear. Early intervention isn't just better for your health, it's dramatically better for your wallet. A simple blood test for creatinine costs $25 to $50, but could save you tens of thousands in the long run, not to mention the priceless value of maintaining your quality of life and independence. While professional testing is ideal, you can also monitor certain kidney signs at home. 1. Foam test. Urinate into a clear container and time how long the foam persists. Normal bubbles disappear within a minute or two. 2. Output tracking. Use a simple measuring cup to track daily urine output. Consistent decreases warrant attention. 3. Color chart. Keep a urine color chart in your bathroom to compare. Ideal urine is pale yellow like lemonade. 4. Weight monitoring. Sudden weight gain, 2+ pounds overnight, might indicate fluid retention from decreased kidney function. These simple checks aren't diagnostic, but can alert you to changes worth discussing with your doctor. Your observations are valuable diagnostic tools. Note when the symptoms started. Record frequency and patterns. Identify factors that make it better or worse. Bring a list of all medications you take. Mention any recent changes in diet or fluid intake. Protect your kidneys. Rather than vague advice to eat healthier, here are specific, actionable steps to support kidney health. 1. Make necessary dietary changes. Add 1 additional serving of vegetables or fruits daily. Replace half your red meat consumption with fish or beans each week. Read labels and choose foods with under 140 milligrams sodium per serving. Measure salt when cooking with measuring spoons rather than pinches. Swap 1 sweetened beverage daily with water infused with cucumber or berries. Dialysis patients face strict dietary limitations. Potassium, phosphorus, sodium, and fluid intake all require careful monitoring, making prevention through early dietary changes infinitely preferable. 2. Try physical activity that's actually doable. Walk for 10 minutes after each meal. That's just 30 minutes total. Practice gentle stretching for 5 minutes each morning. Stand up and move around for 2 minutes every hour during daytime. Find an exercise buddy for weekly activity. Accountability helps. Choose stairs over elevators when it's just 1 to 2 floors. 3. Implement smart medication management. Use a pill organizer with daily compartments. Ask your pharmacist specifically about kidney interactions. Create a list of kidney-sensitive medications, like NSAIDs and certain antibiotics. Never assume over-the-counter means kidney safe. Bring a complete medication list to every doctor appointment. 4. Notice your blood pressure. Check your blood pressure at home weekly. Log readings in a notebook or smartphone app. Aim for below 120 over 80 millimeters of mercury, or your doctor's target. Take medications at the same time daily. Reduce caffeine intake after noon. Remember, kidney health isn't an all-or-nothing proposition. Each positive choice adds up to significant protection over time. Conclusion. To summarize, CKD poses a global health burden with associated risks of cardiovascular complications and even death. The majority of people with CKD are asymptomatic and get diagnosed late. Early signs include foamy urine, blood in your urine, nighttime urination, decreased urination, and flank pain. Recognizing these early warning signs could be the difference between managing your condition with medications and lifestyle changes versus requiring dialysis 3 times weekly for the rest of your life. Keep an eye out for underlying risk factors like hypertension or diabetes that make you more prone to developing CKD. Be knowledgeable about the associated symptoms and what steps to take. These awareness measures can help limit harm significantly. Choosing a healthy lifestyle and getting regular screenings are key strategies for reducing your risk of developing CKD or progressing to kidney failure, requiring dialysis. Small, consistent actions today can preserve these vital organs for decades to come. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you feel your kidneys need some extra care due to unhealthy foods and lifestyle choices, check out the video on the screen. There, we share the top 5 fruits that can help cleanse your kidneys and offer tips to get the most from them. See you there, stay informed, stay healthy.